everyone, and welcome back. I can see our
Hello.
numbers are rising, so we've got 80 people in so far.
How was your morning, Raina? How was the morning in the APOTC so far?
It was good. I attended the session on OT, occupational therapy, and participation in the community. So fantastic researches that are being done. I actually work in pediatrics, but it was all about aged care. So I learned so much just from sitting through that.
Oh,
Makes me want to
wow.
rethink where I.
Were you also able to go to the social lounge?
Yes, I did get to drop by. It was so great. We had it was a couple of us from the Philippines, and then we had someone from Taiwan, and it was so great to find out where everyone's from and make linkages, and it's just great.
That's true, that's true. And I hope that all the other delegates are making use of that lounge so that you can chat with OTs from all around the world. All right.
That's
So,
right. So before we start our afternoon sessions, we just like to remind the delegates of the House rules during the Congress. So the House rules that included, for example, are using the Q&A option. So if you go to conversations on your tab and you see chats and Q&A, you can ask specific questions there. Feel free to use the react buttons. I can't see my react buttons at the moment. Maybe
it's the
because I'm the
smiley
host.
face. It's the smiley face
The
at the
smiley
bottom.
face. There you go. Okay.
Yes.
So I'm just sending out some hearts. Thanks everyone for your reaction so far. Um, and then if AirMeet lags, just refresh the browser. And if you need any assistance, you can click on the question mark button at the lower right-hand corner or email apotc2020@gmail.com. And if you're on social media, I can see I've been tagged in some stories already of my face hosting with Ding. Great memories are always on social media. So if you want to please use the hashtag APOTC 2021 Manila, that would be great. So at this juncture, let me just check how we're going with the participants. It's still kind of rising.
Yeah, I guess we can wait a little bit more.
What?
Just a little bit
We'll
more.
just wait another minute or so. I'm not sure what else. I've been seeing some feedback from all the other rooms as well, and it seems like everyone's been having a great time asking questions and learning more about occupational therapy.
Yeah,
All
and
right. Oh, thank you for that hashtag. Let me see that
APOTC
now.
2021 Manila.
Perfect.
Yeah, I've been
And I
seeing
think
a
there
lot
were
of
some
posts.
questions. I think there were some questions during the break about photos and things like that. So I
Ah,
think
yes. Some of our speakers were asking whether we'd be able to get, they'd be able to get copies of screenshots. And do not worry, we'll be posting them later in the APOTC webpage. All right.
all
So,
right, amazing. I think we're
amazing.
all set.
Yeah.
The numbers have kind of stabilized. All right, so at this juncture, we would like to welcome back Dr. Anthony Gresha, President of the Philippine Academy of Occupational Therapists, to introduce our keynote speaker for this afternoon.
Okay. Good afternoon. It is my pleasure to introduce our afternoon keynote speaker, um, Daryl Barrett. Okay. Daryl is a health policy professional with over 24 years experience working in the health, disability, development, and legal sectors. This has included advising governments on improvements in health and social reforms across 32 countries in the Asia Pacific and in the Middle East. Our keynote speaker has also provided strategic advice to the Australian government on large scale public sector change, leading to adaptation and streamlining of processes and eliminating barriers to service provision for vulnerable populations. Recently, Darryl was the coordinator of the Health Law and Ethics team at the World Health Organization Western Pacific Regional Office. He is currently working with World Health Organization to support the development of a new global report on the highest attainable standard of health for persons with disabilities. It is my pleasure and honor to introduce Daryl Barrett, who is also an occupational therapist. Thank you.
Sorry, Daryl, I'm not sure if we can hear.
We can see you, but currently we cannot hear you.
Yes, still no. It doesn't say you're on mute though. Let me just try and troubleshoot. Give me 1 second.
Okay. Perhaps we can pause the session for a little while to allow Daryl to troubleshoot first, and we shall resume as soon as we can. So we'll just pause the session for a little while.
Hello, everyone. We're back live, making sure everyone can hear us. Thank you so much for your patience. And we would like to just hand over the floor to our keynote speaker, Mr. Daryl Barrett.
Thank you, Raina, and thank you again, Anthony, for that great introduction. I trust you can all hear me now. I'm going to keep going. Yeah, okay, great. This is what COVID has done to us. It hasn't only made us, struggle from day to day. It's made the learning of new technology an absolute must. This is the first time I've used this platform, so I'm certainly getting through my paces. Anyway, look, it's really great to be able to join the Congress this afternoon. I know there's been a few challenges, none to say the least, the delay in putting this together. So it's really great that we've kicked off on this Congress. And I trust everyone's feeling as excited and energized as you were this morning in the keynote from Maryland. As was noted in the introduction, I am an occupational therapist, although I haven't practiced for a very, very long time. I still refer to myself quite often as an OT. And by and large, I was reflecting on that. And I think it's because my OT career has given me such a great depth of opportunities and experiences that I'm not sure I could have gotten in any other profession. So I'm really happy to be able to share some thoughts with you today. And I'm just going to go into my screen now and share this with you. Now, unfortunately, I'm not able to be on the screen when I'm sharing, but hopefully you'll enjoy the presentation even if you don't see me, but I'll pop back on at the end of the presentation for any questions. And like I said, I think that it is important for us to consider that, one of the challenges that we had in the last, 24 months in particular, has been that the world has been under incredible stress and incredible strain, not only because of COVID-19, but because of climate change and a range of other issues. And what I want to do in this presentation is really reflect on ways that I think occupational therapy is well placed to contribute to the health challenges that the health system and health services themselves are facing in the next century. So as I mentioned, there's a lot of challenges right now. COVID, obviously, for the last 18 months, we've all been under this incredible pressure. And I think it's easy to state that in our lifetimes, perhaps we've never experienced such dramatic and catastrophic impact that COVID has had all around the world. But the world is not only challenged because of COVID. There's obviously the long-standing issues related to climate change, which is impacting on all of us and will continue to impact during this 21st century. Then we also see the slow-moving emergencies that non-communicable diseases have had on many countries around the world. And also we can't ignore the fact that in many countries, populations are growing older. So when you couple these health challenges together, and then you link that to the fact that we already have shortages in healthcare workers in just about every country around the world, we have a lot of challenges that we're facing in the health system. Now, I don't want this to be doom and gloom, even though that's maybe how I've kicked off this discussion this afternoon. I don't want it to be about doom and gloom, because that's not what occupational therapy is about. For me, OT is an extremely, extremely positive profession. And I like the way that our friends at WFOT have defined or have conceptualized occupational therapy. And I'm just going to take a few points from them. They state that OT, or occupational therapy, is a client-centered profession that is aimed at promoting health promotion and well-being through occupation. Now, the primary goal of OT, according to WFOT, is to enable people to participate in the activities of everyday life, and also for people to be able to achieve what they want to achieve. And OTs do this by working with people and communities to enhance the ability for people to engage in the occupations that they want to, that they need to, or that they are expected to do. And OTs also have a big role in modifying the environment to better support the occupational engagement that people have. Now, what you see on the screen now are just some of the reflections that I take away from occupational therapy, and in particular the final point around control and meaning, because we all like to have a sense of control over our lives, particularly when we encounter various challenges, either internal or external. And being able to give meaning to what's going on is really, really important. And I think that's something that OT does. It's part of our DNA, and it's really, really important to the way that the profession develops and will develop in the future. So given those core attributes, if you like, of occupational therapy, how do we apply OT to global health priorities? Well, many of us are aware of the Sustainable Development Goals, or the SDGs. But maybe just to refresh us, it's important to note that the SDGs, or the Sustainable Development Goals, are 17 goals with 169 targets that every single UN member state has agreed to work towards by the year 2030. Now, they set out a vision for the world so that we can see that the world would become free from poverty, hunger, and disease. Now, SDG 3, or goal number 3, is central to health. It is the health goal. And it is about ensuring the healthy lives and the promotion of well-being for all people at all ages. Now, all of the other 16 goals are related to health, or their achievement will be indirectly related to health. Now, the goals don't stand alone. You know, the ability to support gender equality or even quality education relies on other goals being achieved, such as good health and well-being to enable people to be able to attend school. So the SDGs aim to be relevant also to all countries, not just poorer countries or less developed countries. And that's really building on from the Millennium Development Goals that were primarily targeted at low or middle income countries, and supporting them to develop in different ways. The SDGs, in fact, aim to promote prosperity while protecting the environment and tackling climate change. And they have a strong focus on improving equity to meet the needs of women, children, and disadvantaged populations in particular, so that we leave no one behind. And I'm sure many of you have heard that mantra about leaving no one behind. And it's really, really important, and it will come up again in the discussion around where OT can fit into supporting the SDGs. Now, goal 3 is the health-related goal, as I said, and it's about ensuring health and well-being for all at all ages. It includes targets such as reducing deaths or disease, and also with regard to health promotion. Importantly, it also includes targets for the advancement or the achievement of universal health coverage, and also the strengthening of government's capacities to manage health emergencies, which I think doesn't need any more explanation at this time in our lives. As health professionals, occupational therapists can relate more immediately to goal number 3 because it is the health goal. And I'll go into that a little bit more detail. But there are other opportunities for the work of occupational therapy to support right across the SDGs, not only because the SDGs are connected, but also because there are some specific goals, for example, education. And I know OTs that are working in the education sector to support children and young adults access quality education through the provision of assistive technology or modified teaching practices or other modifications. Then there is the employment sector, which relates to goal number 8 around decent work and economic growth. We know that it's everybody's right to decent work, and occupational therapy plays a big role in supporting people to be able to undertake the work and the livelihoods that they want to. I want to also touch on the mantra of leaving no one behind. And leave no one behind is really, really important in relation to the SDGs and to occupational therapy, because it's about recognizing and addressing inequities that continue to exclude people from participating on an equal basis as others. And what I mean by that is people with difficulties in functioning or difficulties participating, such as older people or people with disabilities, can often be left behind. And the SDGs is about addressing that. Many people with difficulties in functioning need occupational therapy to support healthy living, including environmental modifications or assistive technology. And this is important because we know that health, or good health, is not just about illness or the lack thereof, but as we can see also on the screen, according to WHO, it's about health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, which also aligns very, very nicely with the holistic approach of occupational therapy. We don't take a strict biomedical approach. We take a very biopsychosocial, holistic approach. And I've actually reflected on my earlier days after graduating and working as an OT. And I would come across, as I'm sure many of you have, come across people who didn't know anything about occupational therapy, although in 20 plus years, hopefully it's changed a bit. And I found the easiest way that I would describe myself is that I would describe myself a little bit like a physiotherapist. I used to say that, and then I quickly realized after I worked for a little bit that we're nothing like physiotherapists in terms of our approach, and we have a very different way of thinking when it comes to problem solving. Occupational therapy takes a very holistic approach to the problem solving that's required for people's health-related challenges. And not a lot of professions do that. I think problem-solving frameworks and holistic frameworks are applied to patient care in the way that people and patients are treated. But I think for OTs, it's in our DNA. And that's why I think we're well poised to support this very holistic approach that's moving forward now. And this is one of the reasons why I think occupational therapy is such a valuable contributor to effective health system strengthening. We need strong health systems to be able to deliver responsive health services and address the challenges that we're currently or continue to face. But before we dive into some of those challenges in a little bit more detail, it's important briefly that we remind ourselves on broadly what the health system is when we use that term. So essentially, the health system comprises all of the organizations and institutions and resources that produce actions whose primary purpose is to improve health. So it's a little bit wordy, but to be honest, the health system is incredibly complex anyway. So the health system is not just about the general practice down the street, or it's not about the big tertiary hospital in another city. It is all of the institutions, all of the organizations and resources that aim to improve health. And it's sometimes useful for us to break down the health system further into building blocks, which I'm sure many of you are familiar with. They're on the screen there. And the health system building blocks are part of a framework that WHO developed in 2007 to help understand the important and interconnected components of the health system. So we have healthcare financing, which both relates to the way the health system is funded, but also how services are funded. We have service delivery, which is a range of models of care, whether it is related to primary care or whether it is related to specialized services, telehealth, a range of different services. Then we have the workforce. That is a massive component of the health system. Then we have medical products and technologies, which are also a central component to the health system and important, particularly if we look at digital technology and advancements. Information and research feeds into the evidence base and helps us understand the best decisions to be made for the health system. And then leadership in governance, which is really about making sure that not only is the health system effective to deliver on what it needs to in terms of service delivery, but that the health system provides stewardship or provides an ability to guide other sectors to supporting good health outcomes. Now, the health system building blocks are often used by governments and development partners as entry points to improve the effectiveness of the health system. And these building blocks also assist us in understanding the performance of different parts of the health system, as well as helping us to understand the relationship between different stakeholders. And of course, in a complex system like this, there are many stakeholders, and some of them include governments, obviously, the private sector. We also, in the private sector, you have the non-profit and the business or for-profit service providers. You have religious entities, which in many, many countries provide a range of health services. And related to that, you have traditional health practitioners. In addition to those, if you like, health service providers, you have all the other non-health service delivery organizations. You know, the delivery drivers, the logistics, the catering, the cleaning, the infrastructure providers, all of the entities that don't directly deliver health services, but are absolutely essential to improving health. So you can see it's really quite complex. And then to add more complexity to the health system with the stakeholders and the purpose, we've got the different levels of the health system. You've got the tertiary level, which is, you know, you're often your big referral hospitals in the capital cities. You've got secondary or provincial smaller hospitals. Then at the primary level, you often have your general practitioners or your health outposts or your clinics that are in the community level. And then you have community services that reach out to people and visit people's homes, etc. And then you have, I've added on family to a level in the health system, and it's not necessarily a formal level, but we know, particularly as occupational therapists, that a lot of our interventions really rely on family members to be able to support each other to deliver the interventions that are needed in terms of OT. Now, I'm sure, well, I hope that any of you who are listening to this and working in the health system can position yourself at different levels in the health system or identify which sort of levels you cut across, because we do work across all levels of the health system. So given that we have these ambitious international frameworks and goals to ensure health and well-being, how do we actually do this? And in particular, what do occupational therapists contribute, considering the challenges that we face? So in order for us to dive more deeply into this, it's important that we consider or we look at some of the challenges facing the health system. Now, governments around the world have let WHO know that there are three large or significant challenges, broadly speaking, that humanity face today. And one of those is the need to ensure that universal health coverage is available for everyone. Another challenge is to make sure that we can promote the health and well-being for all people, promoting healthier populations. And thirdly is to protect people from health emergencies. So let's unpack that in a little bit more detail. If we start with universal health coverage, one of the challenges that we're facing in the 21st century is to advance universal health coverage. And universal health coverage is essentially making sure that everyone, all people, can access the essential health services that they need without causing them financial hardship. It's the cornerstone of WHO's approach and that of many countries. There's a strong link between good health and economic development. So making sure that people can access the services they need over their lifetime without causing them financial hardship is absolutely essential. Now, UHC is important because it covers a range of health strategies, including the ones that you can see on the screen. So I just want to briefly touch on those. So promotion or health promotion is a strategy that enables people to increase control over their own health through a range of population health measures such as road safety campaigns, non-smoking campaigns, healthy eating, taking care of your mental health. So health promotion really takes place at the population level. Prevention is a strategy that aims to minimize the occurrence of disease and associated risk factors through interventions such as screening for cancer or vaccinations. Hot topic at the moment, of course. The third health strategy in universal health coverage is curative or treatment. But I know the term treatment can be used broadly. So curative interventions are really that. The goal of curative interventions or treatment is focused on removing or reducing the disease or the ill health. And it includes very familiar medical, surgical, and related interventions. Now, for an OT Crongus, rehabilitation should need no introduction at all, but I'll do it anyway because in 2018, WHO launched their Rehab or Rehabilitation 2030 initiative, which aimed at increasing the profile of rehabilitation within the health system. And some of you may be familiar with Rehab 2030, but WHO also revised its definition of rehabilitation as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. So most of us understand what rehab is, but if not, this is the latest definition from WHO. And then the fifth health strategy in universal health coverage is palliative care. And that's aimed at improving the quality of life of people with really serious illness to support them to reduce pain and provide comfort. Now, when we are talking about advancing universal health coverage, because it is one of the challenges of the 21st century, there are also some other considerations that we need to take to note. One is around the right to health. Now, universal health coverage is often seen as a financial issue, but at its core, it's really about realizing our right to health. Okay, universal health coverage is about realizing our right to the highest attainable standard of health. Now, we also need to consider how social protection mechanisms are important to UHC because many barriers to healthcare relate to cost, and not only the cost of the health service itself, but also associated costs such as transportation or assistive technology, which are often not covered in health benefits. We also need to consider where we can strengthen primary healthcare services because we know that service delivery models need to be reoriented so that we can support people at home or close to home, close to their communities, so that they can access the services they need across their lifespan. And this is particularly important for people in rural and remote areas. Now, the UHC also enables us to consider how we might address broader health inequities, including gender responsiveness. Because remember, UHC or universal health coverage is about everyone. And if we aren't removing barriers for vulnerable or excluded groups, then we really aren't providing universal health coverage. And again, countries can't always do things or can seldom do things in one big hit. You know, it has to be progressively realized over time. But we should be promoting UHC that is about everyone. And then finally, in terms of health emergencies or protection from health emergencies. Now, even though health emergencies is sometimes considered as a really separate health challenge in the 21st century, it's important to understand that we need strong health systems, particularly UHC, in order to have effective health emergencies responses. Certainly in the early stages of COVID, but even now in many countries where we see COVID under control and vaccines being rolled out, we have to have people being able to access essential health services, we have to have a workforce in place, we have to have surge capacity, we have to have the infrastructure, we have to have the digital technology. All of these things are about advancing UHC, but they also protect us from health emergencies. And so health emergencies and UHC are really two sides of the same coin. And again, I think many of you will have seen that and noted that and experienced that during this COVID-19 era. Now, the next global health challenge you might recall is we've looked at UHC. The next is addressing those healthier populations. And we refer to those as cross-sectoral public health interventions. So, you know, in terms of health not just being about what goes on inside a hospital or clinic, I'm sure most of us in this session now would understand that health is so much more and depends on so much more, including outside of the health sector, both internal and external to the health system. For example, you know, addressing alcohol and tobacco use will involve legislation and regulation of the taxation system, and also involve the customs authorities and retail licensing regulations. So, you know, we may also be involved in advertising or media campaigns. So the issue is that addressing health is not confined to the health system. Clean air and water is absolutely essential for health and well-being, but again, we need to be looking outside of the health sector quite often in order to address those issues. I think it's important now, I'm going to put up this slide and you just need you to take that in for a moment. It is quite a complex slide, but when we talk about cross-sectoral public health interventions, it also gives us an opportunity and a responsibility to really discuss the determinants of health. Okay, so you'll see on the screen, very, very complex diagram on first glance, but when you look at it, you'll see that really the factors and the different components there are all leading to influence collectively on equity in health and well-being. And what that means is that, you know, factors such as education or income or socioeconomic status really impact on health. You know, what else impacts on health is the type of governance structure that you have, you know, what type of government or political system you might live in, you know, what type of services are available across the society, or are you in a very user-paid society, which sets up a different dynamic. You know, and then we've got our own behavioral and biological and psychological factors. Essentially, the determinants of health take us out of that, out of looking at health purely from a clinical or health system perspective, and remind us that we live in a very connected global society. And depending on where we come from, how we grow up, our education, our income levels, etc., that can impact directly and indirectly on our health outcomes. Now, in addition to universal health coverage and cross-sectoral public health interventions, there are some other really key factors that are challenges that governments need to address in terms of promoting healthy populations in the 21st century. And one of those is around addressing non-communicable diseases. Now, NCDs, or non-communicable diseases, are diseases that are not caused by infectious agents, that are usually they're usually diseases that progress slowly over a lifespan and are often impacted by genetic, environmental, and behavioral factors. And of course, some examples of NCDs, as you may know, are cardiovascular disease. Stroke is often an outcome of that. You might have diabetes, and often you see amputations or sensory disturbances as a result of that, and cancer. Now, non-communicable diseases are a really important challenge for health systems because the rate of NCDs is increasing. And if we just look at stroke, for example, we've seen the prevalence of key conditions such as stroke increasing as much as 50% since 2016. I should have added on that slide. We also see that severe disability related to aging populations and NCDs has increased by almost a quarter between the decade 2006 to 2016. Now, one of my very first job after I graduated from university was working at a hospital in Australia, Toowoomba-based hospital, and I covered the male adult general medicine ward, and I had a lot of patients who had stroke, and it was absolutely terrifying as a new graduate to come out and be responsible for supporting somebody to not only get well, but to get well so they could go home. Everything from splinting to assistive device to home mods. So I give a shout out to anyone who's working in the NCD space, because it's challenging, but it's also very rewarding. Now, I want to also mention that in addition to NCDs, aging populations are having a massive impact in terms of challenges for the 21st century. And I know that most of us here would have heard about that and seen that ourselves. But by 2050, 1 in 4 people will be over the age of 60. And one of the challenges is that for many less resource settings, so lower and middle income countries, and I can think of Fiji and Cambodia are the 2 countries that come to mind, the rate of aging is much faster in those countries now than it was for well-resourced countries like Australia and New Zealand. So making sure that their health systems are well-resourced with the workforce, like occupational therapists, is really, really important to be able to address some of the challenges that we know are coming. And this is also because we know that disability prevalence increases with age. Now, I want to also talk briefly about mental health, because although mental health now is being perceived very much as a non-communicable disease and categorized as that, it doesn't get enough airtime, and it's really, really important because we've seen just if not at any other time, we've seen over the last 18 months during COVID that mental health conditions and disorders have increased because of the stress and the strain that the pandemic has put on all of us. And depression is one of the leading contributors to disability, and it was, I think, in 2018 noted as the leading contributor to disability. So it's really important that that mental health is seen as a challenge for the 21st century by occupational therapists, because I know that there are a lot of OTs working in the mental health space and making a really, really big difference. Now, the final category, if you like, of health system challenges for the 21st century does relate to health emergencies. And I know that we've talked a lot about that throughout this presentation, and I'm sure the last 18 to 24 months, you've all experienced your own challenges with respect to the health emergency that the globe is experiencing. But whether it's prevention, preparedness, response, or recovery from health emergencies, they're all key areas for OTs. The lives, families, and communities that have been shattered or that are shattered as a result of health emergencies are important to note. And as occupational therapists, one of the things that we do in our work is we put people, families, and communities central to our approach. And that's what's needed, whether it's health emergency preparedness or health emergency prevention, or whether it's response and recovery. We have to have families and communities engaged in health emergency management in order to be successful. And whether it's supporting the provision of sort of acute interventions or, immediately sort of post health crisis with splinting or assistive technology provision or environmental mods, or whether it's more longer term in terms of supporting people to get back to school, get back to work, or manage in the altered environment. There is a strong role and an increasing role for OTs in health emergencies. Now, OT has a clear role in all of those 3 major health challenges that we're staring down the barrel of in the 21st century. But some of you may be asking why. Hopefully, many of you understand and are starting to join the dots, but I'm going to talk through why I think for 2 reasons, essentially, that OT has a really strong place to play in the global health agenda. And I'd like to think, first and foremost, it's because naturally we take a people-centered approach. And it may seem very basic and straightforward, but it's absolutely essential to effective health outcomes. People-centered approaches to health are important because they promote this co-responsibility between health service providers and the individuals with the health condition. In 2016, WHO proposed a framework on people-centered integrated care, which I believe really speaks to the heart of occupational therapy and the approach that we take. People-centered approaches in the health sector encompass the care provided to people, as well as the health services and the structures and the functions of the health system. Now, for healthcare, people-centered approaches really means consciously adopting the perspective of individuals, carers, families, and communities. Now, adopting the perspectives of these groups, individuals, carers, families, or communities, as participants in and beneficiaries of trusted health systems that respond to their needs and their preferences in humane and holistic ways. And I hope through that wordy explanation, you can pull out some little nuggets or relate to the work that you do, because certainly in the practice of OT, in most of the roles that I had, it was about putting people at the center of the interventions that we would support. And people-centered care also requires that people have the education and support that they need to make the decisions that they need to take and participate on their own. Now, remember I mentioned earlier about health being beyond the health sector and the influence of cross-sectoral factors. OT, one of the great things about OT is that we have to look at the person within their environment, and that's what people-centered care does. And you'll also note that people-centered care is about supporting people to achieve the most complete physical, mental, and social well-being, which relates again to the earlier description of health according to WHO. However, making people-centered care a reality really requires reshaping health services and moving towards services that put people and communities at the center of their interventions. And there are 5 strategies that the people-centered approach looks at, and you'll see them up on the screen now. And the first one is really, they're pretty straightforward from the titles there, but the first one is really making sure that we reach unreached populations that are often vulnerable and left behind, and we make sure that people can feel empowered to participate and manage their own healthcare. And I know that that's what occupational therapists do on a daily basis. They don't make judgment calls for their clients and their patients. They develop treatment plans and treatment processes with people, depending on the goals that people need and people want. The second strategy is about participatory governance. And again, this is making sure that the health system is responsive to what people need in order to be healthy. The third one is reorienting those models of care. And again, we need to be focusing on primary care because, as the populations age, it's more and more difficult for people to be able to access large tertiary institutions, which are really important and really necessary. But what is also absolutely vital is that we have healthcare that is close to people's home and easily accessible. The fourth strategy is looking at how we might align the coordination of services both around individuals, between different service providers and programs, and then, of course, across different sectors. You might have an occupational therapy provider that needs to not only look at the interventions within a clinical setting, but also within a home setting, a school setting, a work setting. And then who you might involve, whether it's the person's employer, the person's educator, or the person's family. So again, very, very basic. And I in some respects, I hope that you've just been reinforced with some of your practice rather than me giving you a light bulb moment and say, oh, this is now what I've got to do. I hope that you're picking up on some reinforcement of what you're already doing. And then the fifth strategy is simply an enabling strategy by creating an environment that supports accountability and strong governance and good funding to be able to have those other 4 strategies take place and be achieved. Now, the second, in my final few minutes, the second major approach where I think occupational therapists really have a strong role to play in supporting and addressing health challenges of the 21st century relate to rehabilitation. Now, in terms of rehabilitation, I mentioned before the definition that it was a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. Again, a little bit wordy, but essentially it's about making sure that people can do what they need to do optimally with the environment as part of that process. And again, that goes right to the core of what occupational therapy is all about. You know, we, in terms of rehabilitation, rehab is about making sure that people can maximize their functioning to take care of themselves or communicate. Rehab is also important because, as we know, the benefits of rehab extend beyond the health sector to other areas of life and has a very positive impact on those other areas. We know that the evidence shows us that rehab reduces the length of stay in hospitals and decreases costs and admissions, which, you know, COVID has taken a real swipe from governments' budgets all around the world. And so any way that we can reduce the costs to the health system through interventions like rehab are really, really welcome. And then the fourth important concept of rehab is that it's part of universal health coverage. It's really, really central to the strategies in health service and health service delivery. Often rehab can be seen or associated as being a service that's just for persons with disabilities. And that's not true. And that needs to be, that stereotype or that approach really needs to be addressed, because rehab is for everybody. Not everyone with a disability will require rehabilitation. It's not a specific service, but there are many people, whether they are growing older or whether they have difficulties functioning, whether it's a long-term disability, whether it's a short-term injury or illness, can benefit from rehabilitation as part of universal health coverage. So it's a really, really important concept. And again, I hope this is not news for anyone. I hope that you all see, for those of you working in rehab or allied health, you see your role and some of these issues around rehabilitation resonate. Now, if you aren't already aware, since this is an Asia Pacific OT Congress, if you haven't already seen the Western Pacific Regional Framework on Rehabilitation, you might be interested in taking a look. This was this is a framework that was developed in 2018 and was agreed by all countries in the Western Pacific that they would take steps to strengthen rehabilitation, and they would actually take steps to strengthen the health system to be able to better deliver rehabilitation. And there is various guidance in that framework, and it should be fairly easy to Google online, but if you get stuck, let me know. I can put the link in the chat. And it's very, very relevant in terms of what WHO is recommending to countries to address some of their health system challenges. So look, I'm just about coming to the end of this presentation, and this is my last slide. So I wanted to leave with 3 really brief takeaways from that very rapid presentation of why I think the world needs occupational therapists in the 21st century, and more importantly, why I think occupational therapy is really well placed to address the challenges of the health system in the 21st century. And the first is because of our approach. Our approach is unique. I really think that the approach that we have as OTs in our work is different to just about any other health professional I've come across. There's a lot of overlap, there's a lot of similarities, but I really, some of you may be familiar with OT being the hard basket. I remember working in many centers where, give it to the OTs because we really don't know how to solve this problem. Problem solving and the approach that we have by putting people and what they need to do at the center of our work is really, really crucial. And that as service delivery models change in the 21st century, that will become more and more important, as will a holistic approach. The SDGs are about leaving no one behind, and that means making sure that everyone can participate. The SDGs are also about promoting health and well-being, and we can't do that unless we take a holistic approach. And that's about the person, their families, and their environment. And again, that's part of our DNA as OTs. So I really think that approach is where health systems are moving more and more to that kind of community primary focused care. And then thirdly is around disability. There is a growing number of people who are experiencing difficulties in functioning. I think, but I don't quote me, I think there's about 2.4 billion people around the world who it is estimated require rehabilitation services. And in terms of people with disability, you have the 15% or about a billion people around the world experience disability. Occupational therapy has a central role to play in supporting people to be able to participate however they want to and however they want to prioritize their participation. And I think that that is only going to serve the profession into the future as we start to tackle these challenges. So with that, I think my time is up. So I hope you've enjoyed this presentation, and I wish you all the very best for the remainder of the Congress. Thank you.
Thank you so much, Daryl, for your talk today. I think it all worked out. We can see you. We could see your
Great.
slides. So
Okay.
thank you so
Perfect.
much. I'm glad it went on without a glitch. I
Perfect.
just wanted to really thank you for reminding us again what's at the core of our roles as OT, and it's that we have so many transferable skills that are applicable to so many areas in the healthcare system. I love the photo you showed of the NCD because I spent some time in Tonga working on early intervention for the community in there. And you're right, we are part of this whole global community where we have so much to offer. So thank you so much for your time. We actually have quite a lot of questions that have come through, but also some great comments. And I know you couldn't see them probably, but there were so many hearts and smileys and clapping things that have come up on the screen. So I'd just like to call on Mr. Lyle Duque to just ask a few questions.
Yes, so he's being
Yes.
called to the
Hi. Can you
stage.
hear me now?
Yes.
Can you hear me? Yeah. Well, thank you very much. That was really fantastic, Daryl. And my question, I actually have two questions. Earlier this morning, we have been talking about occupational therapists taking on different roles. Marilyn touched on that in her keynote, and one of the presenters this morning, Dr. May Lim from Singapore, talked about a curriculum that encourages students to not be contained in cookie cutter stereotypical programs, that they can be the kind of OT they want to after they graduate. So my question is that you have taken on several roles, and one of them is being a health policy consultant. Um, what do you think are the subset of competencies, or if there's just one set of subset of competencies that help you assume and even transition from one role to another, and even in roles that are, well, someone would think that it's really far from OT, like a health policy development specialist. So, what is it about OT that enabled you to take on those roles?
Yeah, great question, Lyle. Tricky one, but off the top of my head, the first thing that comes to my mind is just the fact that it is such a broad profession. And I actually remember my last year of university, and I gave a speech at our farewell dinner, and I mentioned the fact that we can market ourselves however we want to. And I think, even if you want to stay in clinical practice, if you want to stay in clinical practice, you can work in peds, you can work in gerontology, you can work in hand therapy, you can work in, I could keep going on. You get my point. So the breadth, I think the number one driver to the variety of work is the breadth, because OT isn't purely about supporting someone with a particular health condition and getting their body functioning. It's about the environment, and the environment is as diverse as there are people on the planet. So I think if we recognize that, that is the first step towards being able to apply yourself to a range of other areas.
Okay, and second and last question. I don't want to hog the entire. In the Philippines, the universal healthcare law has just been recently passed. So this is the first time we're having it. And my question is, what would be your suggestions in terms of concrete strategies for positioning ourselves, our profession, occupational therapy, to be an integral part of the universal health system, particularly given that right now, very largely we are seen as, just being part of rehabilitation, when in fact we are part of, the entire continuum of care. So if you were to advise us, our national association, our you know our chapters, what would be concrete strategies to help position ourselves and make sure that we are an integral part of the healthcare system all throughout the continuum?
Yeah, great question. The first one is the evidence base. So, and that relates to research, preferably Philippines-based research, but research, in other similar settings that have very decentralized health system like you guys do in the Philippines. Because governments don't want to not fund effective health interventions. They want to do the right thing, but they don't know how. So as a profession, it's up to the OT profession and the leaders to be able to say, okay, we need to get the evidence base right so we can present the case, because the numbers will speak for themselves. I remember when I was working, my first job in London, they had just set up a pilot scheme looking at preventing admissions to the accident and emergency ward over winter, because they have a lot of admissions that are often what they call social admissions, a lot of older people who just weren't coping well at home over the winter. And so if we didn't get those people back home safely, they would end up going into hospital, being admitted, staying for weeks, probably getting sicker, maybe even dying, costing. So I think get the evidence base there so you can present it. The second thing would be about distinguishing yourself from other professions. I don't know, maybe it hasn't changed much in 20 years, but certainly 20 years ago, not everybody, hardly anyone knew what OT was, depending on where you were. So I really think that promoting what you do and what you do differently from other health professionals, and how that can benefit what PhilHealth wants to do, because PhilHealth's taking a graduated approach to rehabilitation. Before PhilHealth, the UHC law came in, rehab had in the Philippines was one of the highest out-of-pocket expenses of any country in Southeast Asia. Incredible. And now that's changing. So it will take time, but it is going there. So I just think being able to distinguish where you add benefit compared to other professions, I think is the other way. So there's probably others, but I know that we're limited for time. Those are the two things that sort of I draw on straight away.
Thank you, Daryl, and thank
Thank
you,
you.
Darla.
Yeah, and
That's wonderful.
actually, one of the questions given by our attendees is related to that, what you've just said regarding evidence base. So I'd like to show on stage this question.
Yeah.
Since research such as UN Sustainable Development Goals informs policy at the global scale, how important are qualitative studies to policymakers who are usually more inclined or persuaded by quantitative data? Can you share a personal experience?
Right, great question. Yes, policymakers are usually more swayed by quantitative data, and the best experience I have, or the most recent, is the work that I'm doing now with WHO on the Global Report on Disability, and we are doing massive systematic reviews and looking at research around disability and different strategies in the health system for participation. It's very, very limited. So, any opportunity that you can take to develop some research. And I would even say, even if you can't do primary research, even if it's difficult to do empirical research because of funding or ethics or whatever, then try and build your case, even from grey literature, even from case studies, or more qualitative feedback from clients and the work that you do, because even if we don't, sometimes being able to tell a powerful story from service users is just as important as having a set of numbers and an Excel spreadsheet. Because often when it comes to politics, politicians will respond and policymakers will respond to the personal stories because they can relate and they can connect. So that's another option, because I know funding for research is often quite challenging.
Thank you, Daryl. And that's especially, I think, relevant for countries like in the South Pacific that are more based on oral tradition. Like you can't get the numbers. So I
Exactly.
think that's fantastic. Thank you so much. Look, there are more and more questions popping up, but obviously we don't have any time left. So I'm not sure, Daryl, if would it be okay if they sent you a message,
Sure.
if we had any other questions upcoming, because I think this conversation is just the beginning.
Sure,
It's
no
so
worries.
new and so diverse. So thank you so much for your
Thank you
time.
so much. And we would like to present the Certificate of Appreciation to our speaker. And it reads the Philippine Academy of Occupational Therapists and Learning Enablers award this certificate, which will be presented on the screen. This Certificate of Appreciation to Mr. Daryl Barrett for sharing his invaluable knowledge as keynote speaker during the 7th Asia Pacific Occupational Therapy Congress hosted by the Philippines via Air Meet this 22nd of November 2021, signed by Roland Lyle Duque and Arcel Rosario Gozon, co-conveners, and Dr. Anthony Gresha, the president of the Philippine Academy of Occupational Therapists. So we're just waiting for it to be flashed on the screen just a little bit. Okay, may I call on our technical team to put it on screen?
While we're waiting for the technical team, I just wanted to say as well, Daryl, that there are breakout sessions coming up. I'm not sure if you're able to stay at all or if you had to head off, but there are opportunities for that. But it's not till 3 o'clock, so that will be 6 o'clock our time, or maybe a little bit later over where you are. So
Yeah.
yeah, so that's also an opportunity. If there are any questions,
Let me just
there we
share.
go. That's it. Perfect
Okay.
timing. Thank you
Great.
so
All
much,
right.
Daryl.
Thank you.
Thank you. Thanks, everyone. Enjoy the Congress.
Thanks, Daryl.
Cheers.
So thank you, everyone, and thank you so much, Daryl, again.
Raina, you've been muted. Sorry.
I have actually muted myself. Sorry about that. We never learn. I just wanted to note that the parallel sessions will continue in the afternoon. So at 2 o'clock, which is right now, followed by a 30-minute break at 3 o'clock p.m. So we have another round of parallel sessions, which will cap off the first day of the APOTC by 3:30 p.m. Once again, you can check the schedule by
Yes.
clicking on the events button at the reception area or going into the schedule tab at the top navigation of AirMeet. Take note of the rooms of the sessions you would like to join, and should there be any concerns, please message any member of the technical committee or email apotc2020@gmail.com.
All right. So I guess that's been it for us, Raina. We are now signing off as your host for the first day of the APOTC.
Yes,
Thank you,
we
everyone.
hope
And
to. I'm sorry, Dee.
sure,
I
go
was
ahead.
going
Go
to say
ahead.
we hope to see everyone tomorrow at 9 a.m. So the keynote speech tomorrow is at 9 a.m. And yeah, thank you so much. Thank you to our technical team that have been so helpful throughout this time.
So enjoy the afternoon sessions. Thank you and goodbye.